Good morning, everyone. I hope that today finds you pain-free or in less pain than normal, depending on if you're a spoonie or not. It's Luthien, as always. I know most people say, like, hey, make sure you like and subscribe and comment on my video, and I'd love it if you guys did, but I'm not going to beg for those every time because I just think that's silly, because people have been using YouTube for how many decades? I mean, it's 2017. You guys know how YouTube works. So today, I wanted to try to ramble a little less and tell you guys the story of how I contracted adhesive arachnoiditis. So when I was 8 years old, I was always small for my age when I was a kid. I was preemie and was always tiny, and being told, in the environment I grew up in that, oh, you're tiny, oh, you're a girl, you can't do, X, Y, Z. So my mom used to go to a health food store and get gallons of, what do you call that? Water, clean water. I can't think of what it's called, the reverse osmosis stuff they do. And she would take 1-gallon jugs in and fill them up and then put them in milk crates. So then, it'd be, 4 1-gallon jugs in each milk crate. So, I was told that, I was too little, I wasn't able to carry it. So I decided that I wanted to prove them wrong. So I picked it up, and as soon as I picked it up, I felt this tearing in my back and burning. But I wasn't going to let that stop me, so I carried it from the back of the store all the way to the front of the store anyway, just to show that I could do it. And after that, I had lower back issues my whole life. The pain never got better. And my parents, being faith healers, they just decided that it was going to get better and never took me to the doctor. Well, fast forward, 2015, I see a pain management doctor that asks me to walk for him. So I do. And he says, how long have you had lower back issues? And I said, oh, I injured it when I was 8. I've been having problems since then. So he sent me for an MRI, and it showed that I had a herniated disc between my L5 and my S1, so the very last disc in the spine at the very bottom. Because, the L5 is the bottom of the lumbar spine, and the S1 is the sacrum, and the sacrum is fused bones. So there aren't any discs in the sacrum itself. And I have osteoarthritis in the rest of my lumbar spine, which really begs the question, if I didn't know that I had osteoarthritis in my entire lumbar spine, how much more of my, back do I have it in? Do I have it in my cervical spine or my thoracic spine? But there hasn't been enough evidence to show that I need to actually go get that looked at for them to do that. So I was told that I needed to get epidural, nerve block, and steroid injections. That doctor performed the first one, and I did not like the way he did it because he pulled my underwear completely off of me. And when you're doing injections in your lumbar spine, you don't need to pull someone's underwear completely off. So I didn't go back to him. So then, fast forward, I scheduled one for July of 2016. So July 6th of 2016, I go in and I get it done. And I was told I had to get 2 of these done before I was allowed to look into surgery for the herniated disc. Now, keep in mind, this isn't a simple herniation. The disc is going up through the vertebrae that's right above it. It's also pushing on my spinal cord, and it's also going off to the side. So it's ruptured pretty badly. So they did the procedure, and then in the recovery room, every time I would get up, I would get this splitting headache. And I told the recovery nurse about that, and she said, oh, but you get migraines, it's probably just a migraine. And I said, no, this isn't a migraine, this is something else. So but they didn't care. They kicked me out anyway. And I trusted them. And about 10 minutes into the drive home, I started throwing up foamy stuff that tasted like rotting lemon juice mixed with a ton of salt. So, I mean, it was nasty, nasty tasting stuff. And when I got home, even laying flat, the headache was less bad, but it didn't completely go away. And I kept vomiting up this stuff, and we're talking like every 10 to 30 minutes. All throughout the night, the most sleep I got was 30 minutes of sleep in between vomiting, and by the morning I was vomiting every 5 minutes or less. So I went to Stanford's hospital, and they said that the procedure had caused a CSF leak. Well, okay, I was warned that 1 in 200 patients get that. So, with the severity of my symptoms, they decided to do a blood patch. And that blood patch failed. So then they decided to do a second one. And that one ended up also failing. And I ended up having about 6 weeks of hell because I'm not going to really go into it, but look up CSF leak. That's the cerebral spinal fluid. So the fluid that's supposed to go up and down my spinal cord and wrap around my brain and cause it to cushion, and like give it cushioning, like was leaking out into my body. And that was causing severe, severe headaches. I mean, it changed my entire pain scale. What was a 7 before is a 5 now. It changed my entire pain scale. And for anyone else who's a spoonie, because I was a spoonie for 5 years before that, something's big if it changes your pain scale. Anyway, and even after the blood patch, or even after the CSF leak corrected itself, it finally healed up on its own. I kept telling them, I have this burning pain in my rear end. I have this, pain in my sacrum. I have this burning and electric shocks going down my legs, which I had somewhat before from my herniated disc, but this was, this is almost constant, as opposed to, once, maybe twice a week if I've done too much physical activity. So then, fast forward to November of 2016, I was hospitalized with a severe systemic infection. I had, normal people are supposed to have a procalcitonin level in their blood of 0 to 0.02, and mine was at 9. So I was considered in critical condition and was told if I didn't voluntarily choose to stay in the hospital, then they were going to admit me against my will. So I voluntarily signed myself in, of course, because there's been twice that I've been admitted to a hospital against my will, and they don't tend to treat you as well. So it took them 5 days in the hospital of them, they did an MRI of my lumbar spine, they did an MRI of my pelvis, they did a CAT scan of my entire body, and they could not find the infection anywhere. They did a spinal tap to check for meningitis, didn't have that either. They couldn't find it, so it just, they gave me meningitis medication for the next month, but it wasn't, they technically didn't ever find it. It was just considered a severe systemic infection. So fast forward to February of 2017, I am using a walker. I can't walk on my own at all. Starting earlier than that, but it was finally in January of 2017 that I got someone to advocate on my behalf with my doctor to let me get a walker, because she was she was worried about taking my mobility down, and the physical therapist in the hospital advocated on my behalf to say no, she really needs this. So eventually I was allowed to get it. Anyway, so February of 2017, I went to see a neurosurgeon about if I could get the herniated disc operated on, and she told me no. She said that I had adhesive arachnoiditis, that it showed it in the MRI of my pelvis in November of 2016, and that doing any kind of surgery on someone's back when they have adhesive arachnoiditis will only make that condition worse. So basically, suck it up and deal with it. And oh, one of the things she said made me so mad. She goes, "We got to get you off these painkillers because you can't be on painkillers long term because, what if you become an addict?" Well, I didn't know then what I know now. There is a less than 5% addiction rate among chronic pain patients because the thing is, when your receptors are feeling pain all the time, you don't get high from pain medication. It's only when your receptors don't feel pain that you can actually feel high from pain medication. So I never understood why people talked about getting a euphoric effect from opiates because the few times I've taken them, I never have. Anyway, and she said, I know some people with this condition that are just at a 10 out of 10 pain all the time and they learn how to live with it, so I'm sure you can too. It's like, what kind of life is that? I'm someone who has never been truly suicidal in my life until this condition started. And it's because I see how much it affects my kids, and I'm hardly able to do anything with them now. Before, I was always taking them places, even with all my other chronic health issues. And now I'm in bed. I'm in bed, or I'm in a car laying down because I can't sit up, so I can't drive. Or I'm at a doctor's appointment, and that's it. That's my life. The four walls of my bedroom, the back porch sometimes during the day on a good day, or doctor's appointments, and that's it. So yeah, it seemed like there was really no hope of survival, and I have to say, most of the doctors at Stanford treated me really well. There was one really, really horrible doctor that I'll talk about in a different video, the one that did my second blood patch. But other than that, they treated me well. But, even my pain management doctor at Stanford, by the time, it was 2 months out from my injections, told me, well, this is beyond my scope of practice. I have to drop you. And she dropped me as a patient. And it was really suspicious because after the first blood patch, after the first blood patch, no, it was before that. It was after the injections when I was in the hospital at Stanford. They said, "Oh, we'll just do a blood patch." And then they looked at my file and their eyes got really big and they said, "Well, let's try to see if it resolves on its own." And I had to go home and be in hell for 2 more days before I went back and told them I can't handle this. Either kill me or do a blood patch. So they did the blood patch. Granted, I was told that there were no risks. I was told that the only risk of the steroid injection was a possible CSF leak, which would cause a mild headache for a couple of days. And I was told with the blood patch that there was no risk of anything bad happening except possibly infection at the injection site. And come to find out, 5% of people that get epidural steroid and nerve block injections end up with adhesive arachnoiditis. And this is an excruciatingly painful disease. It's been said to be as painful as metastasized bone cancer, but without the sweet release of death at the end, because people just live on for years and years in this intractable, severe, debilitating pain. More people with adhesive arachnoiditis die of suicide than all other reasons combined, if that tells you how severe it is. So, Stanford definitely did not warn me that that was a possibility, and they should have. And then, I got the first blood patch, and then that failed, and I got the second blood patch, and bad stuff happened. And then when I went back to see my pain management doctor, I told her, "Hey, everyone who looks at my file, their eyes get really big, then they suddenly start treating me like I'm suddenly going to go psycho on them. Like, what's up? What's in my file?" And she opened it on her computer, turned her monitor away from me so I couldn't even hope to see, not that I could have read from across the room anyway, but turned it away from me and then looked at it for a moment, then closed it. and said, yeah, there's nothing in there. There's no reason you need that. And since then, every time I've tried to get my records from Stanford, they have basically tried to bully me out of getting them, telling me I don't need them, telling me it's just standard, etc., etc. So I really want to know what's in there because obviously there's something. Anyway, so adhesive arachnoiditis. What it is the nerves that come off of my spinal cord. They're called the arachnoid nerves. The nerves that come off of my lumbar spinal cord are inflamed and angry and clumping together, and they are slowly calcifying. And also, the nerves are meant to float freely in the cerebral spinal fluid, and they are beginning to adhere to one another and clump together, and they will eventually clump up against the outer wall of my spinal cord. So not in the thecal sac, but inside the spinal cord itself. And when that's done happening, I will no longer have the use of my legs. I have burning and electric shocks that are almost constant. Sometimes I feel like I'm getting molten metal dumped on my entire body from the waist down. The burning and electric shocks go down both legs and my feet. My groin often feels like it's being placed in a fire, or sometimes I've got electric shocks there. I've had urinary issues since then. It's extremely painful. It's like nothing I could ever describe to anybody. I don't have anything to compare it to. Because you touch something hot. I mean, I got third-degree burns on my arm when I was 3 from touching an old metal toaster from the 1960s, or was it from the 70s? I don't know. It was from before I was born, and I was 3, so most of the stuff in my parents' house were left from wedding presents, so that would have been early 1970s probably. But that was pain that lasted for a short amount of time, and then after putting soothing stuff on it, it felt better. And so I can't compare it to that because the relief from the pain doesn't come. I reach a level 10 pain on almost a daily basis, and the painkillers usually are good at keeping me at a 9, but I'm almost never below an 8. Almost never, and I haven't once been below a 7 since this happened. However, I'm on a good pain day is when I'm hovering at an 8 for most of the day. Sorry about the shaking. I have a cat in my lap that is itching their ear. Anyway, so I think that's it. There's a doctor in Scottsdale, Arizona that is doing stem cell treatment for people with adhesive arachnoiditis. He's had a very high success rate. It's still phase 1 clinical trials right now, and they're going to be going into phase 2 in the next 6 months or so, he said, but right now it's still phase 1, so he doesn't make any money off of it. He only charges like what he needs to charge in order to do the procedures. And he does between 10 and 20 arachnoiditis patients specifically every month. So yeah, but adding up how much it costs to travel down there, and they expect you to stay for a total of 3 to 4 days. So I went ahead and added 4. So hotel, food, transportation, etc., etc. That comes up to about $27,000. Sorry, 27000. And to me, someone who's disabled and on welfare, I get $700 a month, and that's been for since I became sick in 2011. So $27,000. It seems as unattainable as $1 million. But I'm trying to stay positive and hoping that somehow I can fundraise or find people that are willing to sponsor me or something, because he said that they have not had any uh, negative effects from any of the treatments, and everybody has shown some level of improvement at least. Um, so, and there have been, a good portion of his patients that were completely wheelchair bound that were walking and became gainfully employed again and such. So it it gives me a lot of hope, and I'm hoping I can somehow find a way to do it. All right. Well, remember self-care and be gentle to yourselves, and I'll see you guys next time.